Vanakkam. So you have done your general surgery and have decided to go in for super specialization. Great. Some of you would already have decided what specialization you want to do, but some of you may still be undecided on what specialty to do. Or for some of you, your marks may not be enough to fetch you the specialty that you wanted. Plastic surgery is now showing up on your radar as a possible option for choosing as your specialty. When choosing your specialty, you need to remember that this is what you're going to do for the major part of the rest of your life, waking hours. So you need to choose with care. You need to know all about it before you go in and make a choice. What is plastic surgery and what do plastic surgeons do? Is there a scope for plastic surgery? And finally, can I take up plastic surgery? These are the questions running in your mind right now. And these are the questions I have come here to answer in this video. Before I start, I would like to make a disclosure that most of the pictures shown in this presentation are taken from the net for purposes of teaching only. We shall now have an overview of the specialty called plastic surgery under the headings of history, an introduction, the different fields that comprise plastic surgery, the scope of plastic surgery, and what the future holds for plastic surgery. Plastic surgery as such is a poorly understood specialty by both the general public and some of the medical professionals too. It is a unique specialty that defies definition. It has no organ system of its own and is based on principles rather than specific procedures. Plastic surgery is not defined by an anatomic area, like for example ophthalmic surgery, ENT surgery or thoracic surgery, by an organ system like gastroenterology, urology or vascular surgery, or by age group like pediatric surgery or a disease process like surgical oncology. So sometimes it is likely that plastic surgeons perform operations that they have not done before or even seen before and not likely to do again. Some surgical procedures are standardized, but some cut as you go, using the imagination and creativity. Though plastic surgery is mainly science, understanding the basic principles and concepts, when it comes to the execution of the procedure, it is customized. Every procedure needs to be customized for that particular patient, and hence imagination and creativity play a big role in plastic surgery procedures. In fact, the word plastic in plastic surgery is derived from the Greek word plastikos, which means to mold or give shape to. Whenever we talk about the history of plastic surgery, we need to talk about Sushruta, who is supposed to have lived around 1200 years before Christ. He is said to be the son of the sage Vishwamitra and underwent his training under Dhanvantri, who is supposed to be the god of healing. Evidence about the various surgical procedures he has done, including reconstruction of the nose using the skin from the forehead, is chronicled in the treatise, the Sushruta Samhita, which also showcases some of the instruments that he used for the various surgical procedures. Sir Harold Delph Gillies, born in New Zealand, earned the title of Father of Modern Plastic Surgery after his extensive and amazing work on reconstruction for soldiers injured in the World War II. One example is this young man who was injured on his face, and this was the ultimate result after reconstruction by Harold Delph Gillies. But between these two were a number of procedures, staged procedures, which resulted in this amazing result. Now wait, if this is plastic surgery, what is this? that we have always thought as plastic surgery. That brings us to a very important point. Plastic surgery consists of two important components: reconstructive surgery and aesthetic surgery. Under reconstructive surgery, there are many fields: oral maxillofacial reconstructive surgery, onco reconstruction, hand surgery, brachial plexus surgery and peripheral nerve surgery, genitourinary surgery and hypospadia surgery, lymphedema surgery, burn reconstruction, reconstruction in chronic non-healing ulcers, lower limb reconstruction, reconstructive microsurgery and oculoplastic surgery. There are many more, but these are the main fields. Under oral maxillofacial reconstructive surgery, the plastic surgeon manages cleft lip and palate, trauma to the facial bones like fracture maxilla, mandible, and other facial bones including the orbit and the naso-orbitoethmoid complex, soft tissue injuries of the face, which could be a minor injury like this or an injury requiring a major reconstruction. As part of reconstruction on the face, the plastic surgeon also does reconstruction of the nose, the ears, and the lips. Craniofacial surgery for correction of such congenital anomalies is also done in plastic surgery in association with other specialties like neurosurgery. Onco reconstruction, that is, reconstruction of defects after cancer ablation, is also an integral part of plastic surgery. Whether it is reconstruction after breast cancer surgery, where a breast-like mound can be created, or reconstruction after oral cancer surgery, where the skin and lining are reconstructed along with the segment of the mandible if it is removed, or reconstruction after ablation in limb cancer surgery, where function also has to be restored. Any surgery on the hand and brachial plexus surgery form a part of plastic surgery. Be it a major injury with degloving of skin on the hand or even on the tip of the finger, or a total amputation of the hand where a replantation surgery has to be done with fixation of the bones, repair of the nerves, repair of the tendons, and microvascular anastomosis of the blood vessels to restore the blood supply of the severed hand, fractures of the bones of the fingers, which can be managed in different ways to achieve good results and function, tumors of the upper limb, like this example of an embryonal rhabdomyosarcoma which was excised and function restored by reconstructing the median nerve which was involved in the tumor, or even congenital anomalies involving the upper limb, hand and fingers, like this example of congenital syndactyly. Hand infections like these are quite common and need to be treated correctly to ensure good return of function. Surgery for restoration of function following brachial plexus injury, either due to trauma or in the neonatal birth plexus palsy, are also done in plastic surgery. Some types of genitourinary surgery like sex reassignment surgery or gender reassignment surgery are done under plastic surgery, as also hypospadias repair. And this becomes more important when multiple surgeries have been done for hypospadias and major reconstruction becomes necessary. Lymphedema can occur post-mastectomy, post-filarial, or it may be a primary lymphedema. The management of this lymphedema needs plastic surgical intervention. Good results can be obtained with careful planning of the management and skilled execution of the surgical procedures. The management of acute burn is a multidisciplinary approach, but ultimately it is the plastic surgical reconstruction that plays a major role after the patient has been resuscitated and the general condition is stabilized. Like in this little boy who had involvement all over the body following electrical burns and flash burns, or in this young girl who was a victim of acid throw. The sequelae that occur on any part of the body due to burns can be devastating. Reconstruction in such post-burn sequelae are also an important part of the plastic surgery repertoire. Like in this child who had a post-burn contracture of the left hand, went through 8 surgical procedures to get back the function that she needed. The management of chronic non-healing ulcers is also under the purview of plastic surgery, since it is not just healing the wound, it is also restoring function. Diabetic foot ulcers, pressure ulcers, and vascular ulcers come under this category. Lower limb reconstruction is challenging. We need to get tissues to cover raw areas following trauma, burns, or malignancy or infections. Reconstructive microsurgery is one of the challenging fields in plastic surgery. It consists of moving one part of the body or one segment to another, restoring the blood supply to get back form or function. And when we say moving one part of the body, it could be moving skin and subcutaneous tissues, like in this little boy who had a post-infective sequelae on the left side of the face, which has now been resurfaced with a skin flap taken from the thigh. We can also move a muscle, for example, the gracilis, to bring back function to this hand where the function has been lost due to the condition called Folkman's ischemic contracture. We can also move bone like the fibula, which is taken along with its blood supply to ensure a good healing of the bone, like in this boy who had a malunited fracture of the lower end of the radius, resulting in a deformity of the hand. The fibula is taken along with the skin and then used to reconstitute the lost portion of the radius. This transfer of tissue can also be a composite transfer, like for instance transferring the second toe to reconstruct the thumb in this 8-year-old boy who has lost his thumb in an electrical burn. You can see how the reconstructed thumb is being used and how he is able to write after this reconstruction. Oculoplastic surgery is another important part of plastic surgery. Restoring the function of the eyelids is done, and this is so important because these eyelids are needed to protect the eyes. So far we have seen the different fields of reconstructive surgery. Aesthetic surgery is another important part of plastic surgery. Some of the fields in aesthetic surgery are botulinum toxin injection and injectable fillers, breast surgery, augmentation, lift, reduction, fat grafting, rhinoplasty, liposuction and body sculpturing, facelift, brow lift and thread lift, hair restoration and cosmetic gynecology. It is the birthright of every human being to look beautiful, and to help in achieving this, plastic surgery in the form of Botox injections, injectable fillers, laser resurfacing and chemical peels play a major role. Breast surgery comes under plastic surgery. We have already seen reconstruction of the breast following oncological surgery. Apart from that, surgical procedures like recreation of the nipple areola complex, breast augmentation, breast reduction, gynecomastia surgery, and breast lift procedures or mastopexy are also important procedures. Removal of excess of fat from one area and using it to enhance the appearance of other areas is a technique called fat grafting. This is an important part of aesthetic plastic surgery. The nose forms the central part of the face and hence is most visible when we show our face to others. Correcting the problems of the nose, rhinoplasty, consists of different procedures, each designed to enhance the look and the function of the nose. In the search for procedures to look good and feel good, liposuction and procedures like abdominoplasty play an important role. Bariatric surgery is coming in a big way to help reduce fat. But after massive weight loss following bariatric surgery, the body needs to be recontoured or sculpted to look better and tighter. Procedures like corset trunkplasty play an important role. Aesthetic procedures on the face like facelift, brow lift, and thread lift are being increasingly recognized by even the common man. Not only these techniques, but small procedures like genioplasty enhance the appearance of the face and the self-confidence of the person. Hair restoration surgery is an art by itself and comes under the purview of plastic surgery again. A new field called cosmetic gynecology is becoming popular in plastic surgery. It consists of procedures like vaginal rejuvenation and anti-aging. Now we have seen quite a lot of procedures. Does a plastic surgeon do all these procedures? Actually, a plastic surgeon can choose to limit his practice to one of these areas or practice the entire scope of plastic surgery. That is because all plastic surgical procedures have certain common features. The learning curve is quite similar. It is a broad specialty, and the important thing is we can choose our passion within this specialty from the different fields that are available. But importantly, we need to understand the concepts in each of the fields so that good results can be obtained. Having learnt plastic surgery when a person starts off his practice, it may be a private practice as an individual practice. Whatever it is easy to establish as the sole runner in metro cities and in tier 2 cities or even peripheral areas. It is usually mainly referral practice from general surgeons, onco-surgeons, orthopedic surgeons and pediatric surgeons for the first 5 years as far as reconstructive surgery is concerned. Though there are different types of surgeries, they are all skill based and there is intense work in some phases of these surgeries. All of them require a meticulous post-operative follow-up and the patient is usually for life. The result of plastic surgery is not what you see on the table after you finish your procedure. The result will be seen after 3 months or 6 months or after 10 years. The only emergency surgery you may come across in the practice of plastic surgery are limb or finger replantation or facial injuries because plastic surgery is generally not very hectic. The initial calls may be for trauma, but going through this will develop your skills and attitude. Usually there are not many positions for plastic surgeons in corporate hospitals. To start off as an individual consultant, he or she may have to work under the shadow of a senior surgeon for a few years. There is an important part of plastic surgery that we need to discuss now: overlap of surgical procedures. There is stiff competition in cosmetic surgeries like hair transplant from dermatologists, cleft lip surgery from pediatric surgeons, and hypospadias from urologists, and so many more. We need to remember that there are no rigid walls between specialties. As far as I am concerned, competency in plastic surgery implies a special combination of basic knowledge, surgical judgment, technical expertise, ethics, and interpersonal skills. When you take up plastic surgery as a career, what is the lifestyle we can expect? The good news here is that it offers flexibility in lifestyle. You can enjoy a thriving practice in either an academic or private practice setting. For those who love adventure, you can have an exciting and unpredictable schedule when you go into trauma-based reconstructive plastic surgery. Or you can have a controlled lifestyle. For instance, doing only breast reconstruction or cosmetic surgery. You can even go into academic research in plastic surgery, especially in the field of regenerative medicine. So where is the future for plastic surgery? There are already existing challenges like reconstruction after trauma, burns, or cancer, which still need perfecting and refining. And adding on to all these, we have the use of stem cells, regenerative medicine, and tissue transplantation or composite tissue allograft. This seems interesting. Tissue transplantation. Like how tissues are transplanted from one part of the body to another in microvascular reconstruction, in heterotransplantation, tissues are transplanted from one body to another. It involves microvascular anastomosis, the use of drugs to prevent rejection, that is immunosuppression. Single organ transplants are done by other specialties, but composite tissue transplants are usually done by plastic surgeons. And when we talk of composite tissue transplants, we are talking of transplants like the hand transplant, face transplant, and transplants like uterus, larynx, knee joint, abdominal wall. Whatever can be transplanted, it is left only to your imagination. The final question is there a scope for plastic surgery? As long as there are congenital anomalies, as long as there is trauma and burns, as long as there is cancer, as long as there are degenerative conditions like rheumatoid arthritis, as long as there is infection, as long as the human mind craves beauty, there is a great scope for plastic surgery and all its subfields. When Leonardo da Vinci in 1490 imagined that you can use a machine to fly, the Wright brothers in 1903 invented the airplane. There is one such dream of plastic surgeons. Bert Brent in his book has talked about thoracobrachial pterygoplasty powered by muscle transposition flaps. In other words, how to create wings with plastic surgery. He has given the blueprint of how it can be done theoretically using the basic principles and concepts of plastic surgery, but it is yet to be done. I am wondering which one of you is going to make this plastic surgical dream come true.